Go.
Hi, this is Brittany Resch. I'm going to be performing the skill of NG tube insertion for you this afternoon. Okay, so I'm going to go ahead and I'm going to check my orders right away. For Ron Smith, he has an order for an NG tube to be inserted for his small bowel obstruction, and he does have an allergy to morphine. So I'm going to wash my hands. Hi Ron, my name is Brittany. I'm going to be your nurse this afternoon. Can you verify your name and your date of birth for me? And he says Ron Smith. Date of birth 2/1955, and that matches. Okay, so your doctor has an order for an NG tube to be inserted. So basically what that is a tube that goes through your nose down into your stomach. That's going to help relieve some of the pressure from your bowel obstruction. Are you going to be able to sit through the procedure? He says yes. Do you have any questions? He says no. So I'm going to go ahead and provide your biopsy. And he's already in a high Fowler's position, but I would put the bed up if he was not. And I have verified that there is suction. And if you could turn it on, it is working. Okay. Okay, so I'm going to go ahead and put some gloves on. So I'm just going to go ahead and I'm going to inspect the nose. I'm looking for any obstructions or patency. And it looks like there's no obstructions, so I'm going to have him close each side of his nostril and take a deep breath through. And he'll let me know which one is easier for him to breathe through. He says the right one, so we're going to be using the right nostril. I'm going to go ahead and check his gag reflex right away, just to make sure that it's intact. I'm going to stick this at the back of your throat, Ron, just to see if your gag reflex is intact, okay?
Yeah.
Alright. It is intact. And I can go ahead and apply some skin prep to the nose, just for a barrier for that tape. Alright. And I'm going to place this pad down, just in case anything were to come up. So I'm going to get my tube ready here. So I'm going to measure from his nose to his ear, and then from his ear down to his xiphoid process, and that is at 58. So I'll mark that with the tape, just so I know where to stop. Okay, so once that's done, I'm gonna put some lube on, so it's easier. Okay, Mr. Smith, I'm going to have you tilt your head back, and I'm going to insert this with the nasal floor going in a downward direction. And then once I get to the oropharynx, I'm gonna just Make sure that the tube isn't coiling, okay? And then I'll have him tilt his head down, and then we could offer some water, or if he was NPO, we could have him just keep swallowing. But alright, keep swallowing, Mr. Smith. We're almost there. This is really slippery from all the lube. Alright, so if he had any gagging or coughing that didn't stop, we could stop advancing the tube and then kind of pull back a little bit. We shouldn't have any resistance. Okay, so I'm going to go ahead and place this on the bridge of his nose. Go around here. And around there. Okay, the worst of it is over. Okay, so I'm going to take my gloves off and wash my hands. So we would confirm the placement with a chest x-ray before we would administer any medications or tube feedings. And then once, well, that would be the chest x-ray. So every intermittent feeding or before administering medications, you could check placement by aspirating for gastric contents or checking the pH of the gastric contents that comes back. So we're going to say that the x-ray was confirmed and it's placed, so we're going to go ahead and connect it to the suction. And then we're going to turn on the suction as the doctor ordered, so probably low suction. So then I can go ahead and I'm just going to take this off. And I'm just going to put a piece of tape here with a paper clip just so the tube doesn't get pulled out. This is some strong tape. And we'll connect that to his gown. I'll take that from you, Mr. Smith. So again, I'll wash my hands. If this was maybe like a younger child, I could have another nurse or somebody come in and help distract them, possibly like with a toy or a stuffed animal. Or maybe if somebody was unable to follow instructions or was confused, you could have another person in there kind of helping you through the procedure as well. So once this is done, I'll lower the bed. I'll make sure that Mr. Smith is in a safe and comfortable position with his call light. And I will document the date, the time, the size of the tube and the kind of the tube used, the verification of the x-ray placement, how the patient tolerated the procedure, and any assessments that were done. That completes the video.